Okay, so imagine this. Someone's been starving,
Mm,
maybe for days, maybe even weeks, right? And they finally get food.
right.
But
Yeah.
instead of it helping, it makes things worse.
Yeah.
That's
This is a weird one.
It's refeeding syndrome.
Yeah, yeah.
That's what we're doing a deep dive into today.
Yeah,
We're using a couple of medical journal articles to
yes.
guide us.
To guide us, yeah.
And it's more common than people realize, I think.
Right.
So this refeeding syndrome, or RFS,
Mm,
it's this dangerous chain reaction
right.
that can happen when someone goes from starvation to being fed
Okay.
too quickly.
So it's like hitting the gas on a cold engine room.
Yeah, exactly.
It's not as simple as just being low on electrolytes, right?
Exactly. Yeah, you might think someone who's starving would be
Right.
obviously unwell, but
Right.
with RFS, it's a hidden danger.
Oh,
Their body might seem like it's coping on the outside,
okay.
but internally,
Yeah.
different story.
Yeah. Basically, during starvation, our bodies
Yeah.
become really, really efficient
Okay.
at conserving energy,
Makes sense.
even if it means depleting these really important resources.
Okay, so the body goes into survival mode.
Survival mode, exactly.
What's happening at the cellular level during this?
Essentially, the body starts running on fumes.
Okay.
It starts conserving these key minerals, right?
Right.
So you've got phosphate,
Mm,
which helps produce energy.
got it.
Potassium,
Okay.
super important for that steady heartbeat.
Right.
Magnesium,
Mm-hmm.
crucial for just countless processes.
Right.
And it starts pulling these minerals from reserves,
Wow.
sometimes even from bones, which is, not ideal.
Not ideal, no.
So yeah, you're really running on empty at that point.
Okay, so the body's depleted.
Yeah.
And then you reintroduce food.
And the body's like, whoa, 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 what's going on here?
Right.
It's like flipping a switch way too fast.
Yeah.
You get this sudden surge of glucose, right?
Right.
Insulin.
Right.
And it overwhelms the system.
You can't handle it.
The demand for those minerals, those depleted minerals, spikes.
Oh, wow.
The potassium, the phosphate,
Yeah.
everything's out of whack.
And that's where things get really dangerous.
Exactly.
We're not just talking about,
Yeah.
a rumbling stomach here.
Yeah.
What are the real risks here with RFS?
So RFS can cause, this whole cascade
Okay.
of serious health problems. We're
Yeah.
talking heart issues,
Uh-oh.
breathing difficulties,
Okay.
severe confusion, seizures,
Oh, my God.
and in some cases,
Yeah.
even fatal.
That's terrifying.
It's a stark reminder
Yeah.
that even though food is essential, obviously,
Right.
reintroducing it after starvation, it has to be done carefully,
So carefully.
very carefully.
That's a terrifying thought, that something as basic as eating could become life-threatening.
It is.
And you mentioned that this can happen to anyone who's severely malnourished.
Absolutely.
It's not just about, eating disorders.
It's not just people who've, chosen to restrict their intake.
Right.
It can be, think about cancer patients,
Okay.
people recovering from surgery,
Right.
even elderly folks
Right.
who haven't been eating well for whatever reason.
Yeah, makes sense.
Actually, a study by the German Nutrition Society
Okay.
found that 35%
Wow.
of hospital patients in Germany were malnourished.
That's a lot.
That's a lot of people.
Yeah, that number is much higher than I would expect it.
It's a surprisingly high number.
So many people are vulnerable, and it's hard to spot.
And that's the thing.
Yeah.
Recognizing RFS, it's really tricky.
Yeah.
The symptoms like fatigue, weakness, confusion,
Mm-hmm.
they're pretty general.
Right.
Easily mistaken for something else.
Yeah.
Right? You wouldn't necessarily jump to RFS
Exactly.
just based on those symptoms.
This makes me think about that study on German physicians where only 14%
Oh, yeah.
could diagnose RFS correctly from case studies.
Yeah, I mean,
That's alarming.
if doctors are struggling to recognize it,
Right.
imagine the average person
I know.
trying to figure this out.
Yeah, what hope do patients have then?
And that's the thing.
Yeah.
That same study, they found that patients with undiagnosed RFS, higher mortality rates,
Yeah.
more likely to end up in intensive care.
Makes sense.
It's
So-
catching it early is absolutely critical,
Yeah.
but it's easier said than done.
So we've talked about the challenges of even recognizing RFS, but what about treatment? What can be done if someone is at risk?
Well, the good news is RFS is largely preventable
Okay.
if we're proactive about it.
Okay.
The key is,
Yeah.
catching it early and managing that refeeding really, really carefully.
Okay, so no more eat until you're stuffed buffet after a pair.
Exactly. Yeah, no more of those.
Got it.
The American Society for Parenteral and Enteral Nutrition,
Okay.
or ASPN as they're known,
Okay.
they have guidelines, right,
Yeah.
for this very situation.
Makes sense.
And they recommend this start low, go slow approach.
Okay, so instead of diving headfirst into a mountain of food,
Exactly.
we need to take it slow.
Slow and steady wins the race.
So what does that look like in practice?
So ASPN suggests starting with,
Yeah.
reduced calorie intake.
Okay.
Somewhere between 10 and 20 calories per kilogram of body weight per day.
Okay, so for like a 150-pound person,
Yeah.
we're talking like 700 to 1,400 calories a day.
Right, which is lower than a lot of people
A lot.
would maybe expect.
Yeah, that's a far cry from what people consider a normal diet.
Exactly. Remember, we're slowly turning the lights back on for the body.
Right.
We're not going from dark to blinding light.
Right, okay.
So alongside these controlled calories,
Yeah.
we're monitoring electrolytes really closely,
Okay.
like every 12 hours in those initial days.
To make sure that those levels are staying within a healthy range.
Exactly. We're looking at those minerals, the phosphate, potassium, making sure they're not bottoming out.
It's fascinating how such a delicate balance is needed.
It is.
Like something as essential as food,
I know, right?
requiring such careful monitoring.
It's amazing.
It makes you realize that our bodies aren't just simple machines.
No, not at
They're
all.
these complex ecosystems.
They're complex ecosystems, yeah, and it's not just about the quantity of food,
Right.
but also the composition,
Okay.
ASPN recommends this balance of carbs, proteins, and fats.
Right. To give your body what it needs.
Exactly, giving your body what it needs to recover.
So it's about the right kind of fuel.
Exactly.
Not just any fuel.
Not just shoving anything in there.
Right.
It's
Yeah.
got to be the right stuff.
Okay. And what about, sometimes are supplements necessary?
Yeah, sometimes, especially thiamine.
Okay.
That's super important for carbohydrate metabolism.
Got it.
And replenishing it can really help prevent some of those neurological issues
Okay.
that can come up with RFS.
We've talked a lot about ASPN guidelines.
Yeah.
Can you tell us a little more about who they are and why they're so important in all this?
Yeah, they're kind of a leading authority
Okay.
in the field of clinical nutrition.
Okay.
And they're all about improving patient care
Great.
through these evidence-based guidelines.
So they're basing it on research and real data.
Exactly. Yeah. So
Yep.
their recommendations for RFS,
Mm-hmm.
they're based on a ton of research,
Okay.
and they give, healthcare professionals this framework
Right.
to make sure that refeeding is done safely and effectively.
So it's like having a trusted roadmap when navigating this complex medical situation.
Yeah, exactly.
That makes a lot of sense. And this roadmap, it involves a multidisciplinary approach.
It does.
It's not just on the doctor's shoulders.
No,
right?
nurses, dietitians, therapists,
It takes a village
it really does.
to manage this.
Everyone needs to be on the same page.
No.
Communicating, making decisions together.
That sounds like a lot to manage.
It can be.
This makes me wonder if, how technology could play a role in making things easier
Yeah.
for all the healthcare professionals involved.
Absolutely.
What about those clinical decision support systems?
Right.
The CDSS we talked about.
Yes. Yes.
Could they help lighten the load?
That's a great question.
Yeah.
Imagine, like, a world where
Yeah.
computers could analyze your blood work,
Right.
like, in real time,
Wow.
looking for those telltale signs of electrolyte imbalances.
Right.
And be like, RFS risk, RFS risk.
Right.
Like, that's the potential of these systems.
That's amazing.
They could flag high-risk patients,
Yeah.
give doctors a heads up,
Right.
maybe even suggest,
Mhm.
like, personalized refeeding plans.
So it's like having an AI assistant
Almost.
helping to manage a patient's nutrition.
Yeah, in a way.
How far along are we with this kind of technology?
There are some promising developments.
Okay.
There was a study at the University Medical Center Leipzig
Okay.
in Germany. They developed a CDSS
Okay.
specifically to analyze blood work for RFS indicators.
And did it work?
They tested it on a group considered high risk,
Okay.
and the results were really impressive.
Really?
Yeah, it flagged a significant number of cases
Wow.
that might have otherwise flown under the radar.
So it's catching those early warning signs
Exactly.
that humans might miss.
Exactly. Yeah, it's highlighting the potential
Wow.
for technology to really make a difference here.
That's incredible.
Yeah.
It seems like that could be a real game changer,
It could.
potentially saving lives by catching those warning signs.
Absolutely.
But you mentioned earlier that there are some challenges
There are.
with this technology.
Yeah, one of the big ones is that
What's that?
many of these systems
Yeah.
rely on phosphate levels.
Okay.
And a lot of times,
Yeah.
routine blood work doesn't include a phosphate test.
Right. So if a doctor doesn't order it,
Exactly.
the system doesn't have the data.
The system's blind to it.
Right. And so then a crucial piece of the puzzle is missing.
Exactly. It highlights,
Right.
the need for more awareness.
Right. So it's not just about having the technology.
Right.
It's about making sure it's being used effectively.
Absolutely.
And that the data it relies on is being collected.
Yeah, you got to have the full picture.
So even with these advanced systems, we still need that human expertise.
We do.
And awareness.
We can't just rely on the machines to do all the work.
Right, exactly.
It's partnership.
It's been really fascinating to explore this condition, refeeding syndrome.
Yeah.
It's something that I think a lot of people don't really think about that much, but it's so important, and it's been great
It is.
to kind of unpack this and see the innovative ways that,
Yeah.
science and medicine are addressing it.
Absolutely.
But as we wrap up,
Yeah.
it makes you wonder about the flip side.
The flip side, yeah.
So instead of refeeding too quickly,
Right.
what about the risks of not eating enough?
Yeah, I mean, there were definitely
Right.
risks associated with, prolonged fasting
Right.
or extreme calorie
Right,
restriction.
even if it's intentional.
Even if it's,
Right.
you're doing it on purpose.
Right, like a fad diet or something.
Yeah, exactly.
It's interesting because we often hear about,
We do.
like, the benefits of fasting.
Right.
Like weight loss or...
Yeah, improved insulin sensitivity.
Right, all these things. But
Mhm.
as we've seen with refeeding syndrome, our bodies are complex.
Yeah, they don't always respond the way we think they will.
Right. There's always another side to the coin.
There's always another side to the coin.
You can't just focus on one and not think about the other.
Exactly. And, while there's definitely a time and a place for fasting,
Right.
especially under, medical supervision,
Right.
it's not something to just jump into lightly.
Right.
Our bodies need
Yeah.
a consistent supply of nutrients to function properly.
That makes sense.
And when we deprive them for too long,
Right.
even with good intentions,
Right.
it can really throw things out of whack.
Yeah, it's like anything. It's all about moderation and a personalized approach.
I couldn't agree more. Yeah, what works for one person
Yeah.
might be a disaster for someone else.
Exactly.
So, it's really important to remember that,
Yeah.
these extreme dietary approaches,
Right.
they should always be discussed with a doctor.
Absolutely. Get some advice before you just dive in.
Exactly. Yeah, don't just
Wait.
experiment on yourself.
Don't be a guinea pig for yourself.
Exactly.
Well, this has been great. As we wrap things up here,
Yeah.
do you have any final words of wisdom for our listeners?
I think the biggest takeaway here
Yeah.
is that our bodies,
Mm-hmm.
they're always trying to maintain this balance, right?
Right.
This delicate balance.
Mm.
And when we disrupt that,
Yeah.
whether it's through starvation, extreme dieting, even just, chronic undereating,
Right.
there can be consequences.
It's like stumbling upon a hidden tripwire when you least expect it.
Exactly. Yeah.
Yeah.
You're walking through the jungle. You're not paying attention.
Right.
Boom. You've tripped over something.
Yep.
So, yeah, listen to your body.
Good advice.
Be mindful of what you're feeding it or not feeding it.
Right.
And if you're ever unsure about anything,
Yeah.
talk to your doctor. Talk to a registered dietitian.
Get some expert advice.
Exactly.
Great advice.
Yeah.
Well, it's been a pleasure unpacking this topic with you today.
It's been fun. Yeah.
Refeeding syndrome. Until next time,
Until next time.
keep those minds curious.
Absolutely.
Those questions coming.
Keep them coming.
And as always, happy diving.
Happy diet.